Why do we TB test deer? It's obviously to prevent the disease being passed on from animal to animal, to eradicate carrier animals. The main reason for doing it these days is when tuberculosis has been found on a farm and we need to know how many of the deer on the farm have got it and try to eradicate it from within that unit. As far as actually doing the testing goes, there's a set protocol that we follow, which involves catching the deer so that we can easily handle them, clipping the hair off the side of the neck, marking 2 areas on the neck, measuring the thickness of the skin, injecting tuberculin in 2 places, and that's day 1, that's done on day 1, and then 3 days later we come back and we bring the deer back into the crush again and re-measure the injection sites where the injections have been put in. Depending on any changes in thickness of the skin, we will then categorise the animal as a pass, react to where the reaction to the tuberculin isn't enough to call it a reactor.
Okay, and am I right in thinking that tuberculin is basically a protein from avian TB and bovine TB?
Two types of tuberculin are injected. One's avian, which is done on the top of the site, and the other one is bovine, which is done on the bottom of the site. So it's called a comparative tuberculin test. It's the comparison between the swellings produced at each of the 2 sites. The principle of the reaction is that if there are proteins similar to the tuberculin within the animal's body, that the animal will then get a reaction within the skin, which is shown as an increase in thickness and the presence of fluid called edema. And this could be quite a large increase in some animals who've got quite severe TB. We can get increases of 10 or 15 millimetres, but in some animals the increase, especially in deer, can be very, very small, and it can sometimes be literally only 2 or 3 millimetre increases in the skin thickness. So it's quite a precise test. So accurate equipment is used. It's not just, is it a bit swollen? Okay, we'll call a reactor. It's got to be done quite accurately.
Okay. On another subject, Graham, as far as wild deer are concerned, what can sort of deer stalkers do to sort of prevent exposure, prevent exposing themselves to the infection? There's a lot of talk about when you sort of grab a deer, be careful not to sort of damage or incise the lymph nodes, or lesions. Now, if a bullet, for instance, goes through the lungs, the heart and lungs, which 90% of deer in this country are shot through the heart and lungs, if it happens to have lesions in the lungs and that bullet has basically exploded that lesion inside and outside of the carcass as well, I mean, how much risk is your average deer stalker at?
I suppose if the deer happened to have a serious amount of TB within its body, specifically, as you say, within its chest, then yes, there could be a decent amount of risk for the guy handling, getting in mainly through ingesting, i.e. through the mouth, or possibly breathing in. In theory, it could go in through the skin, cuts and things like that, but that would be a very, very small percentage. So wearing some sort of face mask protection when dealing with a dead deer would be a wise thing to do if you feel there's TB in the area. Most lesions that people would see within lymph nodes tend to be what we call caseous lesions, which are quite hard, quite firm, and if you incise them, they just stay solid within the lymph node. So the chances of you being exposed to that are minimal. But if they're actually liquefied lesions and they're producing an aerosol, maybe you cut into a lymph node and it bursts open with pus, then there is obviously a much higher chance of you picking up the TB, albeit a minimal one, but it's still a higher risk. And so wearing some sort of face protection and gloves are probably the 2 things that you ought to consider doing when dealing with deer.
Okay, and then finally, just what can stalkers do to avoid transferring that sort of possible infection from one place to another?
The big thing, if you were to be exposed to what you think is a deer that's got TB, and especially if there's pus and lesions like that, the main way that you're going to pass it on is physically on your clothing. and your boots. So were you to PM a deer that you found had these caseous or liquefied lesions and some got on your clothes, the obvious thing to do is don't go on to another farm while still wearing the same clothes. Make sure that you disinfect your boots between going from one farm to another or dealing with that deer and another one. Those are the two major things. It's not to physically take it from farm to farm on yourself.
Okay, and the best disinfectant is FAM 30.
There are ministry approved disinfectants. There's a list on the VLA website that will tell you which ones are approved or not, but as you say, things like FAM and similar disinfectants are at a certain concentration are perfectly good for killing off TB bugs.
Brilliant.